Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. We are performing a right piriformis muscle release. It's Wednesday, September 4th, 2024. Our patient injured his back and his SI joint, and his piriformis has been torn. We have just completed his SI joint. We're now moving on to the piriformis muscle. Now, the piriformis muscle attaches to the greater trochanter, which is the top of the hip bone, but it attaches to the back of the greater trochanter, specifically to the back top, and that is called the posterior facet and the posterior superior facet. And I am literally docked right on top of that. Oh, it just slid a little bit. Hold on. And shot. And there you go. That's where the attachment of the piriformis muscle is, and that's what we're here to release, the muscle. Now the muscle runs from the tailbone over to the sacrum. From the sacrum, which is the tailbone, over to the hip. And it is a very common cause of buttock pain at the top of the buttock. I'm down against the femoral neck, just feeling it, and I've already released most of the fibers through a sweeping motion. Shot. Dr. B, 30 seconds. We're pretty much done. There's just a few fibers left. I don't even know if you can hear them snapping.
Yes, we can.
That's amazing. Again, that's the piriformis muscle for you. It attaches from the tailbone over to the hip, and we've developed a minimally invasive way of releasing the muscle to get rid of piriformis pain. And it's all done outpatient without a big incision on the buttock. Let me show you the incision. Come on out. Okay. Here's your incision. It's quite literally 4 millimeters. And we pioneered this technology here at Deuk Spine Institute. I pioneered it because the alternative for patients with piriformis pain is to make a large cut on their buttock. You have a marking pen? This is what the orthopedic surgeons have done for years. They make an incision from here to here, and they literally cut through the gluteus maximus. And when you're done with your surgery, you have a big defect. You have a big scar, your butt muscle is cut, so it looks like a canyon, and it never looks the same. You get atrophy, and then it hurts like hell for months. And a lot of times it doesn't even work, and they damage the sciatic nerve, because the sciatic nerve runs like literally right here. But you can see we're not near the sciatic nerve, we're to the side of the sciatic nerve, so we don't have the risk of injuring the sciatic nerve where we are working, because it's very safe where we're working. That's why I did this technology, this technique. I developed it this way to be safe, but also effective. All right, thanks for joining us. Any questions?
No current questions.
Great, thanks everybody, and we'll see you next week.